All right. Hello and welcome everyone today. Thank you for joining us. I am Sam Glazer Houston with the University of Minnesota Alumni Association, and I'm excited to welcome you to today's webinar, Emerging Experts, Rapid Fire Research from Rising Scholars. In today's session, we'll hear from a group of PhD students and candidates who competed in the 3-minute thesis competition. We're so lucky to have them joining us. And before we get into the introductions of our speakers, a few housekeeping notes. Today's session is being recorded and it will be shared with everyone who has registered and also uploaded to our website for continued access. You'll also receive a follow-up email that includes a program evaluation, as well as ways to keep being involved. So be sure to stay tuned. As questions arise during today's talk, please submit them to the Zoom Q&A function, and we'll be moderating them as they come in to be asked during the Q&A portion of today's session. Today's session will feature 5 amazing PhD students and candidates who represent 5 different colleges here at the University of Minnesota, and who each competed in the 3-minute thesis competition, where they had only 3 minutes to share their research to a general audience. This is a tall order. Here to explain more about how this works is Nuru Andrew Manalina, who serves as our Assistant Vice Provost for Graduate Student and Postdoctoral Initiatives here at the University of Minnesota Graduate School. She's also affiliate graduate faculty within the Department of Organizational Leadership, Policy and Development, and is also a member of our alumni community, earning her PhD in Educational Policy and Administration from right here at the University of Minnesota. Welcome, Nuru, and now over to you.
Okay. Thank you, Sam, and hello, everyone. I am Nuru, and I'm going to share my screen so that I can talk with you a little bit about the 3-minute thesis competition. It is founded by the University of Queensland in Australia, and it has become a worldwide phenomenon. The University of Minnesota celebrated the 10th year of the competition this last November, Friday, November 14, 2025. The competition is typically held during that week of November, the teens, on a Friday. And it's good to know a little bit about what is the 3MT. It challenges graduate students to communicate the significance of their research without using props or jargon. They have 1 slide and their time limit is 3 minutes. If they go even a second over 3 minutes, they are disqualified from the competition. And at the University of Minnesota, we have different levels for graduate students to advance. We have departmental level, where they compete within their department to see who gets to go to the collegiate level. And then at the collegiate level, the University of Minnesota Graduate School hosts the university level. And then those who win at the university level goes to the regional. And if you win at the regional, you go to the national. And if you win at the national, you go to the international. So this is a very well-recognized and well-participated event across the world. So it helps students develop communication skills needed for all career paths. And it encourages students to be succinct and engaging when describing their research to a non-specialist audience. So the idea is that you should be able to talk about your research to anyone who is interested in being engaged in a conversation. And the 3 minutes is just an introduction, a way to have further conversations. And so the judging criteria is comprehension, content, engagement and enthusiasm, and communication. So that's what our participants are judged on. So the 3MT competition at the university-wide, our Dean Scott Lanyon is the MC. And we typically have senior leadership come and also share their congratulations in advancing to that level. So Rebecca Cunningham, President Cunningham, was there at the 3MT for 2024. Dr. Gretchen Ritter was there, our provost, this past November. And so just to give you an idea, if you weren't at the competition, these are past presenters, past participants from different colleges who have advanced to the university-wide. Okay. And then we have a 15-minute deliberation time for the judges to decide the runner-up and the winner. And so this past November, these were our judges from different organizations and sectors outside the University of Minnesota, primarily. And so the first place winner gets $500. Second place is $250. And then we have a People's Choice at $150. So these are past participants, just to give you a sense of what the competition is like. So this was our very recent one in November, and some of those faces are familiar because they will be presenting to you today. So Nisha Vishwanathan, who will present today, was our runner-up from last year. Vitora Bongwat took the first place from last year. So we're going to get started with the presentations, and I'm going to introduce each of our speakers. Our first presenter is Jason Hatfield. Jason is a PhD student in the Comparative and Molecular Biosciences program, working in Dr. Sagar Goyal's lab. He studies how far UVC light, a safe form of UV light, can help stop the spread of respiratory viruses in animals and people. He's passionate about science to protect both human and animal health through a One Health approach. He earned his bachelor's from Berry College in 2017, double majoring in animal science and biochemistry, and has worked across the USDA, Iowa State University, and reproductive medicine labs, gaining experience in vaccine research, diagnostics, biosecurity, and public health. Now, his research focuses on finding safer, more effective ways to control airborne viruses like avian and human metapneumovirus. By testing far UVC light in real-world settings, he hopes to help reduce disease transmission, improve biosecurity, and support healthier environments for both people and animals. Jason will be presenting on This Little Light of Mine, a bright solution for airborne diseases.
All right, thank you for the introduction.
Thank you.
Let's get started. A poultry farmer washes his hands and switches out his boots and overalls in a clean room, standard biosafety protocol, before walking into one of the many identical turkey coops holding 10,000 turkeys that his family's had for 3 generations. He brings in some feed, checks over his flock, and then leaves. Within 4 days, every one of his birds will either be dead or dying, and he'll be forced to call the survivors in order to save the rest of his farm. This very scene is playing out over and over and over again in the state of Minnesota and across the US as farmers are facing one of the worst avian respiratory disease outbreaks in nearly a decade, all caused by a virus that most people aren't even aware exists. Avian metapneumovirus is a respiratory disease that has a major impact on the poultry industry. In just the last 8 months, it's cost more than $112 million in loss just to the state of Minnesota alone, with some estimates as high as $1 billion nationwide. While it is important to note the virus in and of itself doesn't cause high mortality, it is extremely contagious and uniquely able to cripple the immune system of young animals, which in many cases leads to dangerous and deadly secondary infections. In older animals, it decreases weight gain and egg production, affecting the entire industry. Now, how this virus is spreading into these biosecure facilities and, more importantly, how to actually prevent it is the literal billion-dollar question I'm trying to answer. I study how long these viruses can survive on common materials found in poultry barns like cardboard, plastic, and metal. I test how factors like temperature and humidity influence their survival and how easily this virus is able to become airborne and spread. But my work goes beyond just watching what this virus does. I am also investigating how to actively stop it from spreading using a form of ultraviolet light called far UVC light. Now, unlike traditional UV light, which can cause sunburns and skin cancer, far UVC light operates at a very specific lower wavelength. What that means is that it's significantly safer for both human and animals as it can't harm our skin, yet it can still kill pathogens. In my lab, I test whether far UVC light can inactivate avian metapneumoviruses on surfaces, in the air, and perhaps most importantly of all, how it can actually be applied to real world settings. If successful, this research could lead to better disinfection strategies in both animal and human facilities, something that we call One Health approach. Because when we protect animal health, we're also protecting human health. In an increasingly globalized world where viruses move between animals, people, and the environments that we all share, we need tools that work across all different areas of life. And sometimes that tool is as simple and as powerful as a safe, invisible light. Thank you.
Thank you, Jason. Our next presenter is Shani Kim. Shani Kim is the third-year PhD candidate in nursing in the School of Nursing. Born and raised in South Korea, she earned her bachelor's degree in nursing from Korea University and worked as an intensive care unit nurse. Driven by curiosity about the world beyond hospital walls, she pursued a Master of Public Health at Seoul National University, where she discovered her passion for infectious disease epidemiology. Just as she began her career as an epidemiologist, the COVID-19 pandemic struck. She imagined herself rushing to outbreak scenes like a firefighter, but soon learned that data actually drove every response. Her research focuses on designing effective and efficient ways to manage and share public health data, empowering frontline professionals, including nurses like her, to spend less time on documents on screens and more time with people. And communities they serve. Outside of her research, Shani finds joy in cooking for her beloved daughter and son and cleaning up the joyful chaos they leave behind after every meal.
Thank you for the kind introduction. Okay, I will begin my presentation. Did you know that measles, a disease once declared eliminated in the US, had over 2,000 reported cases last year alone? But have you ever wondered, how do we even know that these outbreaks are happening? How do we detect the moment when a few isolated infections turn into a public health emergency? The answer lies in something like a fire alarm, a system designed to detect danger before it spreads. In public health, that fire alarm is called disease surveillance. Think of when you cook a steak. A bit of smoke rises, nothing alarming yet. But if you burn it, the smoke thickens and the fire alarm goes off to stop a real fire from spreading. Disease surveillance works the same way. There are always some cases in every community, but when infections start to increase rapidly, our public health fire alarm must respond quickly. Traditionally, when clinicians, for example, nurses like me, identify a case of an infectious disease, they have to check all the required information, fill out a report, and send it to public health agency by fax, mail, or phone call. The whole process relied on human decision and manual work. It's like having a smoke detector that only works when someone remembers to press the button. I'm studying a system called ECR, electronic case reporting, which is like an automatic fire alarm for infectious diseases. As soon as a diagnosis code or positive lab test is entered into patient health record, that information immediately triggers the ECR to generate a report and send it directly to the public health agency. The alarm sounds the very moment the very first mock appears. My research focuses on evaluating how effective ECR really is and how it can be improved. I conduct quantitative analysis using surveillance data from Minnesota Department of Health to assess how timely and complete ECR reporting is. I also conduct several one-hour interviews with clinicians and public health professionals to understand their challenges and find a way to improve the ECR system. By combining both of these insights, this study aims to make ECR faster, more accurate, and easier to use. Because the earlier we detect, the sooner we can respond and save more lives. I believe this research helps keep our attention not on paperwork or computer screens, but on the people and communities we aim to protect. The next time you hear an outbreak has been detected, remember that somewhere a quiet electronic fire alarm has already gone off. Thank you.
Thank you, Shani, for the presentation. Our next presenter is Olivia Kukan. Olivia, or Liv, is a third-year PhD candidate in molecular pharmacology and therapeutics in the lab of Kaylee Schwertfeger. Her thesis work centers on understanding and leveraging the complex functions of tumor-associated macrophages to improve breast cancer therapies. Post-PhD, Liv looks forward to applying what she's learned to serve in leadership roles within the biotech industry. Her hobbies include ballet, lifting, and cooking, and she's a firm believer in playing outside. Liv will be presenting on Demolition Day, turning breast cancer macrophages from bricklayers to wrecking balls.
Thanks, Nuru, for the introduction. Anyone who was around the Twin Cities last summer will agree that the old adage was especially true this year. Minnesota only has 2 seasons, winter and construction. So today I'm going to introduce you to 2 construction sites in the human body that help illustrate my thesis research in breast cancer immunology. Breast cancer is a disease that has surely touched the lives of nearly every single person in this audience. And while we've come a long way in treating breast cancer, some patients still don't respond well to our current treatments. So understanding the science of breast cancer and how our bodies respond to it is a crucial step in the discovery of new therapies. I study a type of immune cell called a macrophage and its role in breast cancer. And the best way to understand macrophages in cancer is to think about their role in the normal wound healing process. Over here on the left, when you get a paper cut or scrape your knee, you're opening up your skin to bacteria and debris. And macrophages are a specialized type of immune cell that identifies and swallows germs and alerts the other cells in the immune system. Eventually, the paper cut does close and the knee does scab. And the cool thing about macrophages is that they help with that step too. They rebuild the skin tissue, help the blood clot, and tell the inflammatory immune system, we've got a handle that's no longer needed. So now moving on to the right side, on our second site, if we zoom into a breast tumor, we find the tumor microenvironment, which consists of the cancer cells, but also the immune cells and other structural components in the tumor. The diverse functions of macrophages that we talked about in the normal wound healing site become disorganized and sometimes used by the tumor to help support its growth. And so just like construction workers have the capability to both take a jackhammer to the road and lay down new asphalt, depending on what orders they're given, macrophages in the tumor also have the capability to be both demolishing and building, depending on the cues they're getting in their environment. A demolishing macrophage alerts the immune system, sending messages to kill the tumor cells as it would to germs in a paper cut. However, a building macrophage treats that tumor like a scabbing, healing wound, suppressing the immune system and building structural support that unfortunately helps the tumor grow and spread to other parts of the body. My thesis really has two big ideas. The first is to study and understand what cues in the tumor microenvironment are driving the demolishing and building responses. And the second is to engineer pro-demolishing instructions to give macrophages orders to take a wrecking ball to the tumor, ultimately contributing to better outcomes for cancer patients and their families. Thanks for listening.
Thank you, Olivia. Our next presenter is Itoro Bang Yuwat. Itoro is a fourth-year PhD student in the Division of Environmental Health Sciences at the School of Public Health, where she has also recently begun pursuing an MPH in the same field. She also works as a grad research assistant in the Stepanov Research Lab at the Masonic Cancer Center. Itoro holds both bachelor's and master's degrees in clinical biochemistry. Her research explores toxic and carcinogenic components in tobacco products, secondhand smoke emissions, and air pollution. She is especially interested in how the chemical composition of hookah tobacco affects secondhand smoke exposure among non-users, especially children in diverse populations. Itoro has presented her research at conferences and a symposium and recently won first place in the People's Choice Award at the School of Public Health's 3-Minute Thesis competition. Outside of her academic work, Itoro is a passionate artist who enjoys drawing, painting, and creating art pieces. Itoro is the second Judge's Choice and People's Choice winner at the University of Minnesota wide 3MT competition held on November 14th, 2025. She will represent the university at the regional 3MT competition in Kansas City, Missouri on March 22nd, which is next Friday. Okay.
Thank you, Nero, for the introduction. If you watched Alice in Wonderland as a kid, did you ever wonder what this caterpillar was puffing? To me, it just seemed whimsical because I didn't know what it was back then. It wasn't until recently, when the scene flashed back in my mind, that I realized that's a hookah, which is also known as a water pipe. This 1950s classic portrays that it was okay to smoke hookah around a kid then. Now, here we are in 2026, and that perception hasn't changed in reality. This photo still mirrors current scenarios, like a dear friend of mine lounging with a hookah at home with kids nearby. Young adults in the US enjoying hookah around younger siblings, or even immigrant families gathering with hookah as a centerpiece. Beyond the potential exposure in kids, what else do these scenarios share in common? It's the misconception that hookah is safe, which is fueled by a lack of awareness, policy gaps, and the components of hookah itself, like its appealing flavors, the sugars that mask the harshness of the smoke, and the water that many believe purifies it, all feed this false sense of safety. But what if I told you that a hookah session lasting 45 to 90 minutes compared to just 3 to 5 minutes of a cigarette generates about 27 times more of a human carcinogen called formaldehyde and 3 times more addictive nicotine? Surprising, right? Well, here is the kicker. Despite this, hookah tobacco is exempt from most tobacco control policies. It's like the mischievous sibling of the tobacco family that somehow gets away with anything. So when I say I'm on a mission to demystify that sweet deception surrounding hookah, you'd understand why. My research investigates how the flavors, sugars, and toxicants in hookah tobacco influence smoking behaviors and risk perceptions. I examine how these factors increase the risk of exposure in kids living with users through air sampling, chemical profiling, and survey evaluations. Speaking of kids, these kids are exposed without choice and are particularly vulnerable due to their faster breeding rates and immature immunity. So I also work with high prevalence communities to raise awareness on secondhand smoke exposure and advocate for changes in smoking behaviors. Because the bitter truth is, Behind the appeal of hookah tobacco lie health consequences that affect more than just the users, but loved ones that we wish to protect. Thank you.
Laura, I think you're muted.
Can you hear me now?
Yeah.
Okay, thank you. Sorry about that. Nisha is a fourth-year PhD candidate in biochemistry, molecular biology, and biophysics, the Freeman Lab, where she studies peptide natural products. Outside the lab, she enjoys cooking new recipes and trying to grow a garden without killing everything. Nisha is the runner-up at the University of Minnesota-wide 3MT competition held on November 14th, 2025. Nisha?
Thank you, Nora, for the introduction. I hope everyone's still with me. Quick question before I start. How many of you have taken an antibiotic at some point in your life? I'm going to take a guess, almost all of you. So let's keep that in mind. The truth is, many of us in this webinar are only here today because antibiotics once saved our lives or the lives of our parents and family. But now we are on the edge of a global crisis because bacteria are fighting back. Recent news warned us about the rise of nightmare bacteria. These are germs that have become so dangerously resistant that even the best of our antibiotics cannot stop them. It's a true nightmare for doctors and to all of us because suddenly a simple cut, a sore throat can become a death sentence. This is the silent pandemic we are walking into. And it's why we urgently need better weapons. But here's the irony. Many of our best antibiotics were inspired by bacteria themselves. If you zoom closely into the microscopic world, there is a constant war between germs, a real-life Game of Thrones with endless battle for territory and for survival. And to compete, bacteria produce these remarkable chemical weapons, molecules that can kill, disarm, or outsmart their neighbors. And that's where my research comes in. Our lab has discovered a set of these natural molecules with a built-in armor. You can imagine them as these tiny soldiers, nature's armored drugs you see on the screen behind that shield. Each one is protected with a special chemical modification, those little CH3s on their backbone. This critical feature acts like an armor plating, transforming these ordinary soldiers into stronger, tougher, and a more resilient antibiotic army. So you may ask now, why does this matter to us? And how does it matter? How does this work? So normally when you take a drug, our body often tries to break it down before it can take full effect. But this natural armor can protect the drug, giving it the time to stay active and effective in our body. And chemists struggle to design these kind of unique design. But certain bacteria do it so gracefully, and they are the masters at installing this design. So by studying bacteria's DNA and the molecular machinery that create these armored drugs, I aim at leveraging nature's own design to develop tomorrow's stronger medicine, to help us stay one step ahead in this ongoing battle against nightmare bacteria. So stay safe, healthy, and happy. Thank you for listening to me today.
Thank you, Nisha. So those are our presenters, and I just want to say thank you. Maybe we can just do a Zoom clap for them for the phenomenal work that they are doing, and we're just so proud of each and every one of them, and definitely wish Toro luck next week as she represents the university at the Midwest Association of Graduate Schools. I just want to make sure for those of us in the audience, if you're interested in attending the live competition, it's only in person if you're in the Twin Cities. Please make sure that you reserve your calendars for Friday, November 13th, 2026. It will be in the Kaufman Union Theater, And we hope to see you there to support our graduate students in person if you are in the Twin Cities area. And so with that, I will turn it back to Sam and stop share.
Amazing. Thank you so much to all of you. I feel like I've just want to keep hearing more about all of your research and your topics. And also big compliments to how prepared you all were. Clearly, the rehearsal that you put into this was a huge amount of work, but so compelling to hear all of the different topics that you are exploring. And it does feel like you're each on the cutting edge of important research for the world, honestly. So thank you all for your work. We're going to jump into some question time now. So I'm going to invite all of our presenters to feel free to answer as they can, if they want to chime into any of these topics. And for our audience, feel free to add questions to the Q&A function here in Zoom as well. To kick off our questions, the first one we want to know about each of you. How did you choose your topic? And what was the hardest part of distilling it down into just 3 minutes?
I can go first.
Thank you.
Honestly, the topic was easy to choose. It was one of my thesis projects. And I've always been fascinated by how nature still has so many things to teach us, and we don't know all of it. And it became personal when my aunt in Minnesota also, like, she faced a MRSA infection just 2 years ago and had a heart surgery because of it. So it felt like this was the topic that was absolutely worth like talking about. And one of the hardest part about preparing was to leaving out all of the chemistry that I love, the mechanism, the data, the structures. Like, I kept reminding myself that the audience don't care about it. First, the details don't matter in this case. Of course, details matter a lot in research, but not in this case. So if you want to make people care about something, and 3 minutes is still enough to do so, but you have to pick one topic, one discovery, and why it matters. So that's how I do it.
Yeah, thank you. I totally appreciate your personal connection to your topic and also the passion that you bring to it. That's amazing to hear. And hard to not share the data, because I know that's probably where you spend a lot of your time actually doing the work. So
Right.
totally can hear that pull as well.
Yeah, it's definitely the biggest heartbreak to be like, I want to show all the cool things that I have discovered, but people don't always, well, it's discouraged to try and talk about that. And impact isn't the focus of 3 Minute Thesis. It's about how you tell the story. And so it's always like, but I have really cool stuff to show. And it's hard sometimes, but I agree with her on like this, the how you choose the topic is it's at least for pre-docs, it's definitely just your thesis project. But it's really hard just being like, I have to leave out this cool stuff, or I know I try and layer a lot of things with mine. Just if you're familiar with the topic, it hits a little harder. So, like when I mentioned the 3 generations of farmers, a lot of family farms are the ones that are being shut down, and they're the ones that are being hit the most. These generational farms that are being ravaged by this disease right now that I study, and so I don't want to go into long detail about that because that takes up time to actually talk about the subject. But if you're familiar with the subject, it's easy to layer that in and just be like, "Oh, I'm talking about this." But if you have any idea about what's going on, you actually know that that's a deeper context. And so, I think it's trying to interlay as much information as you can for people who have no idea about the subject, and also people who might have an idea about the subject can appreciate that you're being honest and deep about what you're talking about.
I totally agree with Jason, because including all the details, it distracts from the core message that you hope to convey with your presentation. So in my own case, I had to leave out certain details about the air sampling, the biochemical analysis, the epidemiological methods. And although all of these details are very essential for the academic work, it would actually overwhelm the audience. So in leaving out some of these details, I kept asking myself this question: does this particular detail help the audience in understanding why this research matters at this moment? And if the answer was no, I left it out. So my topic, which is specifically hookah tobacco, the sweet deception, and the bitter truth, I took into consideration that hookah tobacco products are usually portrayed or marketed as organic, fruit-based, safe. It contains sugars that mask the harshness, and it even leaves an aftertaste after using. So this is the sweet deception that actually drives the misperception of safety. And unfortunately, even when hookah contains similar types of chemicals that you would find in cigarette, it's not treated with the same level of urgency when it comes to policy. So I felt the need to use my topic to juxtapose the sweet deception with the bitter truth while highlighting existing policy gaps so that the audience could have a feel of what is happening with the deception and what is the actual truth regarding around my research.
That's amazing to hear. And as you all are answering the question, I noticed like little pieces of your presentation are even coming through in how you're thinking about the topics. And I love the way you incorporated such a strong title to then kind of be pulled through as a theme in the session as well. I think that adds just another compelling angle and layers on those important pieces as well. The next question we have for you is, what storytelling choices did you make to really keep your audience engaged without oversimplifying the research, which clearly you all needed to do to get your points across, but how did you kind of strike that balance?
I think I can answer the question with connecting to the first question. So my research topic actually came from my previous experience working as an epidemic investigator in Korea. And like Nuru mentioned when introducing me, I started that job imagining myself kind of like a firefighter, going from one outbreak site to another outbreak site and putting out fires. But once I got into it, I realized that everything really comes down to data. And that's what led me to choose informatics as my field of study. And while exploring this area, I learned about electronic case reporting in the US, which helps reduce the documentation burden for both hospitals and public health agencies, and also allows for more timely responses. That's how I ended up choosing it as my research and presentation topic. But one of the most important and honestly the hardest parts of this 3MT competition was having to explain everything without using jargon. And like some of our other presenters mentioned, it was really challenging to help the audience understand why the topic matters without going into too much detail. That's actually why I chose to start with measles, because we all know that measles outbreaks was there last year and still now, to make it more relatable from the beginning to audience. Yeah, so overall the whole process was incredibly helpful at the end of the day, after this competition, all of our research is meant to make people's life better. And in that sense, I think this experience really helped me to move closer to that goal.
Yeah, I totally agree on not using jargon. You guys are gonna have to excuse my pipetting. I the data demands it. So I totally agree with the jargon thing. I'm in immunology, so acronyms are everywhere all the time. And in particular, to answer the first question on why I chose my topic, I decided instead of going after the real research question and the specific signaling pathway that I study, to just explain like one concept of cancer immunology. And the concept I wanted to explain was, how can an immune cell in a tumor be both for the tumor and against the tumor? And the answer is because that's how it's supposed to behave in normal tissues. And so that's where I went with that analogy. Um, and the hardest part, I think, was like Chani said about not using jargon for sure.
That makes total sense, and I love that you're doing the research actively as you're
Yes.
answering the question.
I was like, I'll get my pipette real quick. I
I'm
gotta
not trying to show off.
showing us up.
I'm just trying to keep my RNA healthy.
Oh, I feel that.
That's
So
awesome.
I could
And
also, oh,
sorry, go
sorry.
ahead, Ito.
Okay, so I could also talk about some of the things that I used in engaging the audience that I feel kept the audience engaged. I think the reference to the Alice in Wonderland story, which is a classic that a lot of people relate with, and it brings a whole lot of nostalgic feeling, was really helpful in keeping the audience engaged. Alice in Wonderland has been around for a lot of decades, but it's relatable across different generations and globally because I do have fond memories of watching it as a kid in Nigeria. So just beyond the nostalgic connection, that scene where the caterpillar was actually smoking a hookah around Alice depicted secondhand smoke exposure in children. It actually portrayed the message that I hoped to convey with my presentation. So I know that really helped. And then I also used a little bit of humor where I referred to hookah as the mischievous sibling of the tobacco family, which a lot of us can relate with. We may have mischievous siblings, or we may have been the mischievous sibling. You can do a lot. The mischievous sibling can do a lot, and would typically get away because you don't really have much to hold them accountable to their mischief. So, in the same way, hookah tobacco is doing a lot, but there is insufficient data to actually influence policies that could control or regulate hookah use. So these were some of the analogies that I used that I feel kept the audience engaged, and then including some questions to draw the audience into the presentation rather than leave them as passive listeners.
I
I
think.
I
Oh, sorry.
complete.
I was just gonna say I completely agree. The something that we could all hold on to as a childhood memory is a great way to make the connection for folks. A couple of you have referenced like trying to make it really hit home for people, so that totally makes sense. And I think we'll go to Nisha and then Jason next.
Yeah, I agree with Itoro as well, and I leaned heavily on analogy, like those tiny soldiers, the armor plating, Game of Thrones. None of that is in my research papers, but it's all true to the science. And as she mentioned as well, like when you open some with the opening line as something that is universal, so asking the questions, making the audience feel engaged, as well as like for me, antibiotics like have touched almost everyone's lives. And I felt that once people feel connected to the problem, then they're willing to follow you to the science, which is what I was trying to achieve. And I tried comedy, and it did not work for me in this case. So when I did my first trial run, people were like, "Oh my God, we are so scared! Like, what's this night? Like, we're aware of what the antibiotic resistance is. We are aware of nightmare bacteria." So I think I went with fear, but it still connected people. So there's just so many ways that you can, yeah, tell a story.
Great point.
Humor is really hard to make work in 3 minutes like this, and
Yeah.
hit the audience that you want. There's so many science jokes I tried out, and I was just like, no, like there's gonna be three people who are laughing incredibly hard at this joke, and no one else is gonna get it because it's just really deep lore. How I approach it is, I am an older graduate student. I worked for years for the USDA. I've been on the forefront of some of the big influenza outbreaks in the past couple of years. And I've helped make the flu vaccine for birds for the past couple of years, many years before I did grad school. So my approach was more like how I talk to farmers a lot. And I've been in the field for many years working with the farmers, and I've been at some of the culling facilities and everything else. And it's always horrible when that happens. And so I want to be really direct when I talk, and how my speech shaped up was how I talk to the farmers. I hit them with the facts they want to hear, the economic problems that the virus is causing, relating it to like the things I've physically seen. I've gone to these farms and I've done the biosecurity checks with these farmers and going over, how could we possibly have a security breach? Here's our SOPs for our biosecurity. And so when I wrote my speech, I really kept in mind what they always wanted to hear. The farmers do not like a lot of jargon and they do not like a lot of crap. They want you to be very straightforward and straight shooting. And so I was trying to describe that in a way and be very. I talked to them how I made my speech how I talked to them. It's very straightforward, I think, in a lot of ways, and the facts that they want to hear first. They don't care about the deep genetic differences in strain 7.1.1 and 7.1.2. They want to know how to fix it, right? And they want to know how to address it. And so I was trying to be very direct with how I wrote that because they always seem to appreciate that. And they are not as like they're a lay audience in a way, like they have some scientific background, and some farmers are very, very well not versed in it, and some aren't as versed in the deep molecular biomes. So I try to keep it the same way I talk to them in the field.
I can appreciate that, like the folks actually using the output of your work and keeping it so that it's very applicable to them makes a lot of sense too. We have a couple of audience questions that I'll kind of pair together for you all to consider. People want to make sure that you have funding to support your work. Could you talk a little bit about that and then also how you're going to continue from here to carry out the rest of your thesis work?
The loaded question for every PhD student. I could just start again. I'm covered by a CTSI translational grant. So another part of the research I don't talk about in my talk is there's actually a human version of this virus called human metapneumovirus. It's actually the second most common childhood disease in the world. But we don't care about it as much. It's like when a kid comes into the hospital or doctor and they say it's something viral. It's 9 times out of 10 human metapneumovirus. It's the same like avian, though, in that if you get a secondary infection, it can turn very deadly very quickly. So that's why they sometimes give antibiotics with a viral infection. But there's just not enough time in 3 minutes to talk about all of that work. And so when I go on about One Health work, is that I study the viruses are species specific, so they can only affect humans, can only affect humans, avian can only affect avian. But they are incredibly closely related. And so there's a lot that we can learn from studying one over the other because of different things that we can test, right? We can't test in humans, and there isn't a really good animal model to test human metapneumovirus, but avian metapneumovirus is so closely similar that we have the perfect model to go ahead and test it in. And so I actually work with both viruses, and I do the same work for both viruses. And I compared the biology between the two viruses a lot. And so I'm funded by a translational science grant that pushes for this zoonotic and cross-species viruses. So I'm personally funded by that, which helps free up a lot of money for my lab to pay for the research itself, because my stipend and insurance and everything else is covered by that.
That's great to understand.
Yeah.
I'm also, oh, sorry.
Oh, go ahead.
I'm also funded by a fellowship similar to what he said, and it's through the University of Minnesota. We apply for funding through the NIH, and the NIH gives the university money, and then the university gives this T32 out to a select group of students in cancer training specifically is what my fellowship is focused on. And I'll just say that on the funding point that we've been pretty fortunate in cancer that it has been affected, but less affected than some of my colleagues who work in infectious disease research and HIV research. And so I feel like I'm personally in a pretty fortunate spot, and starting to conversations around being creative with funding and how we can look for outside sources. Philanthropies are huge, especially for cancer.
Thanks for sharing that. That makes a lot of sense too.
Yeah,
I'm funded pretty similar to Olivia's as well. And as for the second question, where do you go on from here? I think you can answer that in two different ways. Like as with research, like there's just so many things that we can do with peptide natural products. So we are mainly working on bacteria. So we identified certain genes that we are very interested that make these special modifications. But we are yet to figure out a lot of their activity profiles. So which is what I'm focusing on as well, in isolating those compounds and then testing them for several different functions. As well as on a personal note for like a career trajectory. I think from here, what I've learned from 3MT and how I'm gonna like carry on from here is I've learned that ideally I had the trajectory that I would go into scientist one, scientist two, and go on from there. But now it's like there are doors that are open. Like I talk to several people, like also learn about science communication, about different leadership roles. So that has been pretty interesting to learn that a lot of skills are transferable, and so that's been an interesting experience.
Thank you, Nisha.
Yeah, in my case, my advisor, Dr. Sri Priya Rajamani, has been collaborating with the Minnesota Department of Health for a long time. Through that connection, I was able to work with them, access research data, and gain experience as a research assistant. And working with them also helped me develop a much deeper understanding of ECL overall. And for the second question, actually, even in the US, ECL hasn't been fully implemented for all reportable diseases yet. And even where the technology exists, not all hospitals are using it. So there are still a lot of work to be done, even here in the US. And at the same time, there are many countries that aren't even familiar with the concept of ECR. For example, in my home country, South Korea, although it's widely known for its strong IT infrastructure and highly digitalized healthcare and social systems, very few people are aware of ECR. So to successfully implement it's not just about understanding the concept itself. It also requires coordination between hospitals, EHR vendors, and public health agencies. So my next goal is to help introduce ECR to other countries. I think this is because I think one of the most important lessons we learned from the COVID-19 pandemic is that we can't protect ourselves by only focusing on our own country or community. We can only truly protect ourselves by protecting everyone. So based on what I've learned, I'd love to contribute to expanding ECL globally so that it can help strengthen public health for all of us. Yeah.
Okay. My funding is also supported by an R1 grant and by the Institute for Global Cancer Prevention and Research, where my advisor, Dr. Irina Stepanov, is the director. And to answer the second question, I see my research as going beyond the lab bench into extending into conversations and dialogues that are aimed at creating awareness about the harms of hookah tobacco and also advocating for changes in smoking behaviors. And if I have to change the narratives that is going on, the misconceptions, I need to go into communities. I am already working with some communities where hookah use is highly prevalent. The Oromo community here in Minnesota, the Somali community here in Minnesota, and it's also prevalent among the youth. So my goal is to reach out, create dissemination materials that could be distributed. We do lab tours where through the lab tours, we also create awareness about hookah products and other tobacco products. So the goal for me is beyond just getting the data, is to making sure that the data reaches the people that it should reach, while the big picture is to influence policies thinking about the immediate effects, which is the community around, the people around. Can I start by changing their smoking behaviors? Could the changes in the smoking behaviors protect children more? So that's really where what I plan to do with my career.
I realize I didn't answer this second question, so I apologize. I'll pop in real quick. I know we got a couple minutes left. I'm working with local farmers, as I briefly mentioned in my speech, to actually apply this technology. And I've done many farm tours to talk about key areas to put the light in. And biosecurity is kind of what I work in now. It's kind of become an expertise over the years. And so I hope to continue with it, whether it's with UV light or something else. With respiratory viruses, particularly potentially zoonotic viruses like influenza or avian and human metapneumovirus. I'm currently working with a hospital, one of the hospitals here. One of my mentors, Dr. Beth Thielen, she's amazing. We're working with her to look at how to apply this in pediatric wards because it's safe and it's in emergency rooms and areas where we're really worried about secondary infections as well. So I'm currently looking at like going into industry of some kind and actually getting this technology better applied. But I'm always open to government or academia as well. But that is where this research is hopefully going, is to be able to apply it in more real world settings. And that is a major factor in how I do my research, is can we actually apply this and how do we make it work? So
That's amazing. Thank you all so much for clearing with all these questions. It's fascinating to hear all of your direct connections and how you all are really thinking about the way that your work will apply to the real world around us and improving things for the human condition, really. So thank you for all of your work and showcasing it today for us. I'm going to wrap us up. I want to extend again a huge thank you to Nuru and all of our presenters. It concludes our time for today. And of course, we want to thank our Alumni Association members for powering everything that we do. Thank you to our audience for joining us, and be sure to watch your inboxes for some key follow-up messages. Thank you once again to all of you, and have a great rest of your day.
Thank you,
Thank
everyone.
you.
Thanks, Sam.
Thank
Thank
you.
you.
thank you.
Thank you.
Thank you.